Yes. Now we'll discuss about the suboccipital triangle. First of all, make a diagram. This is posterior view of the skull. Here you can see this bone is occipital bone. This is lambdoid suture. This is occipital bone. Here is external occipital crest. This is superior nuchal line. This is inferior nuchal line. This is superior nuchal line. This is inferior nuchal line. This is superior and this is inferior nuchal line. This is margin of the posterior margin of the foramen magnum. This is posterior margin of the foramen magnum. Here. This is mastoid process. Here is position of. This is transverse process of the first vertebra, first cervical vertebra, that is atlas. This is posterior arch of the atlas, and here lies. This is posterior arch. This is anterior arch. Here is foramen transversarum. This is foramen transversarum. This is superior articular surface. This is vertebral canal. In this diagram, this is posterior arch. From here to here, this is posterior arch. This is posterior tubercle. So there is posterior arch, posterior arch of atlas. This is posterior arch of the atlas, and this is posterior tubercular. So this is posterior arch, this is posterior tubercle. This is foramen transversarum. This is foramen transversarum. This is posterior arch of the atlas. This is posterior tubercle of the atlas. Atlas. Here is another thing, that is the bifidus spinous process. Here is This is spine of axis, second vertebra. This is bifidus, spine of the axis. From posterior margin to here, and one important thing that is here is first nerve C1. This is ventral ramus of the C1. This is dorsal ramus of the C1. This is ventral ramus. Here is ventral ramus. This is dorsal ramus of the C1, first cervical nerve. And another important thing, through foramen transversarum, here one artery passes. That artery is vertebral artery. So this artery passes here. This is third part of vertebral artery. So here lies, this is third part of the vertebral artery. From here to here, this is third part of the vertebral artery. This lower part is second part. This third part lies here. This is third part. This is third part of the vertebral artery. And another important thing, this is posterior arch of the atlas, and this is posterior margin of the foramen magnum. From here to here, a membrane is present. That membrane is known as, this membrane is known as posterior atlanto-occipital membrane. This membrane is known as posterior atlanto-occipital membrane. This membrane. And another structure. This is posterior tubercle of the atlas. From this posterior tubercle of the atlas, the muscle takes origin and is inserted here below the inferior nuchal line. So this muscle is rectus capitis posterior minor muscle. This muscle is rectus capitis posterior minor muscle. This muscle is. This is rectus capitis posterior minor muscle. Another muscle which arises from the spine of the axis and inserted lateral to this. This muscle is longer than this. That's why it is known as rectus capitis posterior major muscle. So this is rectus capitis posterior major muscle. And the muscle from transverse passage of the atlas runs upward and inserted between these two nuchal lines here. This muscle is superior oblique muscle. This muscle is superior oblique muscle. And the muscle which takes origin from this spine of the axis and inserted under the transverse process of the atlas. This muscle is inferior oblique muscle. This is inferior oblique muscle. Now you can see this is a triangle. This is suboccipital triangle. So boundary of the suboccipital triangle, inferiorly by inferior oblique muscle, superolaterally by superior oblique muscle, superomedially by rectus capitis posterior major. This is supplemented by rectus capitis posterior minor. So these two muscles form the superomedial boundary. Floor of this is formed by, as you have seen, floor is formed by this structure, that is posterior atlanto-occipital membrane. And content of this, you can see here, this is posterior ramus. This is posterior ramus of the C1. Sorry, this is spinal of C1. It has anterior ramus. This is posterior ramus of the C1. And this posterior ramus of the C1 gives supply to inferior oblique, gives supply to superior oblique, gives supply to rectus capitis posterior minor and major, both. And also it gives supply to the muscle which lies over this, which forms the roof. So this is content of this triangle is two important things. One is, this is third part of the vertebral artery, and another is, this is C1 spinal nerve. Its dorsal division which gives supply to the branches of these muscles. Now roof is formed by, all these structures are covered by roof, and a roof is formed by, here one muscle is attached. This is semi-spinalis capitis. If you draw this diagram here, this muscle lies over this. This is semi-spinalis capitis. This lies here. This muscle covers this. This is semi-spinalis capitis, and another muscle, that is longissimus capitis. So this is longissimus capitis and semi-spinalis capitis. These two muscles form the roof of this triangle. So roof is formed by two muscles, semi-spinalis capitis and splenius capitis. This is semi-spinalis capitis, and this muscle is longissimus capitis. Sorry, this is longissimus capitis. Longissimus capitis. So these two muscles form the roof. One important thing, that is first nerve, the second nerve. This is, here is second nerve which passes below this inferior oblique muscle and turns like this. It pierces this muscle, semi-spinalis capitis, and reaches into the here. And also it pierces the trapezius muscle. Here another layer is present, that is trapezius. It also pierces the trapezius muscle. This is dorsal ramus. This is thickest cutaneous branch present in the body. This is greater occipital nerve. This is greater occipital nerve. greater occipital line. So this is structure of this suboccipital triangle, boundary, content, roof and floor. This region is critically important because in case of failure of the lumbar puncture, cistern puncture is done here. So this is important for the cistern. Now we'll discuss about the triangles of the neck. The triangles present on the lateral side of the neck. In this diagram, you can see here is position of the mandible, here is position of mastoid process, this is external occipital protuberance, this is level of the mastoid process, this is level of the mandible. Here is position of hide bone. This is hide bone. This is clavicle. This is manubrium sterni. This is clavicle. Here is acromion process. This is acromion process. This will draw later. This is the side of the neck. If you see the boundary of the side of the neck, you will find anterior is bounded by anterior medial line. This is anterior medial line. This is anterior medial line. Posteriorly, it is bounded by, here is position, this is position of trapezius. This is anterior border of the trapezius. So posteriorly is bounded by anterior border of trapezius. Superiorly, it is bounded by base of the mandible. This is base of the mandible. Here is imaginary line between angle of the mandible to mastoid process. So base of the mandible and imaginary line between the angle of the mandible to mastoid process and superior nuchal line. So this, from this part to this part, this is superior boundary. And here is inferior boundary. This is clavicle. So this is side of the neck, quadrilateral in shape. Here is muscle which arises from the manubrium sterni, which has two heads. This is tendinous head. Another head is musculotendinous, which arises from the clavicle. This muscle is sternocleidomastoid muscle. So it takes origin from here, clavicle and manubrium sterni. It has two heads of the origin, and is inserted in the mastoid process and also on the superior nuchal line. So here, this is sternocleidomastoid. Sternocleidomastoid muscle. This muscle divides this lateral side of the neck into two triangles. One triangle is here and another is here. You can see the boundary of the triangle, anterior triangle, anteriorly bounded by this is anterior median line, and anterior border of the sternocleidomastoid muscle here, and superiorly by imaginary line from mastoid process to the angle of the mandible and base of the mandible. So this is anterior triangle, this is posterior triangle. Its boundary is anteriorly by posterior border of the sternomastoid and posteriorly anterior border of the trapezius, and inferiorly this is clavicle. So this is anterior triangle of the neck, this is posterior triangle of the neck. So the triangles are again divided. Here is position of the hyoid bone. This is hyoid bone, and here is a fibrous pulley. Here is anterior belly of the digastric. This is anterior belly of the digastric muscle. Here is posterior belly of the digastric muscle. This is posterior belly of the digastric muscle. So anterior belly of the digastric, posterior belly of the digastric. And another muscle, that is stylohyoid. Here is styloid process also. So stylohyoid muscle also runs along this, along the posterior belly of the digastric. Another muscle that is like here, this is superior belly of the omohyoid, passes deep to this and turns like this. Here is inferior belly of the omohyoid. This is superior belly of the omohyoid. This is omohyoid. Superior belly, and here is inferior belly of the omohyoid. By these anterior belly and posterior belly of the digastric and superior and inferior belly of the omohyoid, these triangles divided into several small triangles. Here anterior triangle, this is anterior triangle, it is divided into this triangle. This is carotid triangle. Here, from here to here, this is muscular triangle. From here, this triangle is the submandibular triangle, and here this level, here a triangle is formed, that is submental triangle, and posteriorly this posterior triangle is divided into two parts, occipital triangle, and this is supraclavicular triangle. So this is occipital triangle, this is supraclavicular triangle. So there are several triangles formed on the lateral side of the neck. So we will discuss one. Now we will discuss about the posterior triangle of the neck. In this diagram, the side of the neck, here you can see this muscle is trapezius. This is trapezius. This muscle is sternocleidomastoid. And here, there is another muscle attached with the hyoid bone. This is superior belly of the omohyoid, and here is inferior belly of the omohyoid. This is superior belly of the omohyoid, this is inferior belly of the omohyoid. By this inferior belly of the omohyoid, this posterior triangle is divided into two triangles. Upper triangle is occipital triangle, lower triangle is this triangle is supraclavicular triangle. It lies just above the clavicle. So this is supraclavicular triangle and this is occipital triangle. So first of all, we'll discuss about the boundary of the posterior triangle. Here is, you can see this is posterior border of sternocleidomastoid. It forms the anterior boundary. Posterior boundary is formed by anterior border of trapezius, and inferior boundary is formed by upper surface of middle 1/3 of the clavicle. So middle 1/3 of the clavicle, upper surface. This is base, this is anterior boundary, this is posterior boundary. Apex is found here at the superior nuchal line where anterior and posterior boundary meets. So this is boundary of the posterior triangle of the neck. Now we will discuss about the roof. Here this is covered by skin, then superficial fascia. Superficial fascia contains, from here you can see this platysma muscle lies. So superficial fascia contains platysma muscle, and other structures which lies here covers this. After removing the skin, we will see the content of the superficial fascia. Here you can see this is here nerve region in superficial fascia. This is lesser occipital nerve. This nerve is a lesser occipital nerve. Here is another nerve. This is great auricular nerve. This is great auricular nerve. And here is anterior cutaneous nerve of the neck. This is anterior cutaneous nerve of neck. Here is supraclavicular nerve. In the three supraclavicular nerves. So here you can see there are 4 cutaneous nerves which lie in superficial fascia, and 1 vein. Here is this vein is external jugular vein. So these structures form the roof of this posterior triangle of neck. So this is all about the boundary and roof of the posterior triangle of the neck. In next video, we'll discuss about the content and floor of this triangle. Thank you. So you have seen the roof of the posterior triangle. In the roof, there are 4 nerves: lesser occipital nerve, great auricular nerve. Here is anterior cutaneous nerve of neck, and these are 3 branches of the supraclavicular nerve. And here is vein, that is external jugular vein. In roof, you have also seen the platysma. Here platysma muscle is present, and also there is deep fascia, that is investing layer of the deep cervical fascia. So here is skin, superficial fascia. These are the content of the superficial fascia, and then there is a deep fascia, that is investing layer of the deep fascia, which covers this from the roof of the posterior triangle. Now we will discuss about the floor of the posterior triangle. Here, this is posterior triangle. I am drawing here. This is posterior triangle. Here is your roof, floor. Floor. This is floor. Floor is formed by here. This muscle is semi-spinalis capitis, and another muscle that is splenius capitis. So from here to here, this is splenius capitis, and another muscle that is levator scapulae. This muscle is levator scapulae. This muscle is levator scapulae. Semi-spinalis capitis, splenius capitis, levator scapulae, and here is scalus anterior. This is scalus medius. This is scalus anterior. This is scalus anterior. This is scalus medius, and this is scalus posterior. Here lies scalus posterior. This is scalus posterior. In this diagram, this is level of first rib. This is first rib. This is second rib. This is second rib. So these muscles form the floor of the posterior triangle of the neck. Now, these muscles are covered with, this floor is covered with prevertebral fascia. That is fascia of the neck. Like here, you have seen the roof is lined by, internally lined by investing layer of deep cervical fascia. Here, this is covered by prevertebral fascia. So this form the these structures form the floor. So this is floor of the posterior triangle. Now content of the posterior triangle. Here you can see these nerves form the content of the triangle. Here is this nerve. This is this nerve. This is lesser occipital nerve. This is lesser occipital nerve. And the nerve here which ascends upward. This is great auricular nerve. It also lies here. This is great auricular nerve. And the nerve here is supraclavicular nerve. This is supraclavicular nerve. Here it pierces the deep fascia. So this portion lies in the triangle and form the content of the triangle. So this is content of the triangle. This is supraclavicular nerve. And the important nerve, that is this is spinal accessory nerve. This is spinal accessory. This is spinal accessory nerve. It accompanies with C3 and C4 nerve which give supply to levator scapulae and trapezius. This is C3 and C4 give supply to trapezius and levator scapulae. And the nerve, here is position of upper middle and lower trunk of the brachial plexus. These gives branches. Here is nerve to rhomboid, suprascapular nerve, nerve to subclavius, and also here is serratus anterior, also nerve to serratus anterior is also present. Nerve to serratus anterior. So these nerves lies in the posterior triangle of the neck, and here this is anterior cutaneous nerve, also arise from this. Some part of the anterior cutaneous nerve lies here. Now vessels and lymph nodes. Here are these are lymph nodes, cervical group of lymph node, and here is occipital artery. This is occipital artery. This is occipital artery, which is a branch of external carotid artery. This is occipital artery. Another important thing, this is subclavian vein. This is subclavian vein, and here is subclavian artery. This is subclavian artery. Here is, this is external jugular vein. This is external jugular vein. Here it pierces the deep fascia and reaches into the subclavian vein. This is external jugular vein. And tributaries of this external jugular vein, here another vein, suprascapular vein. There is accompanying artery, suprascapular artery, which is branch of thyrocervical trunk. There is transsuperficial transverse cervical artery. This is again branch of the thyrocervical trunk, and thyrocervical trunk is the branch of subclavian artery. This is subclavian artery. This is subclavian vein. So these structures form the content of the posterior triangle. You can see here, this is spinal accessory nerve. This is spinal accessory nerve. Above the spinal accessory nerve, you can see in this diagram and also in this diagram, there are very few structures. Only this is present here, and here some lymph nodes, and this artery is present. And below to this, there are several structures here and here. So, for the clinical importance, for the surgical importance, this portion is careful area of the triangle. This is carefree area of the triangle. So this is carefree area of the triangle. This is careful area of this posterior triangle for the surgeons. Thank you. This is all about the posterior triangle of the neck. Thank you. Yes. Now we'll discuss about the anterior triangle of the neck. In previous lecture you have seen posterior triangle. This is posterior triangle of the neck. And now we'll discuss about the anterior triangle. So boundary of the anterior triangle is superiorly bounded by base of the mandible and a line joining the angle of the mandible to mastoid process. This is mastoid process. Anteriorly, this is anterior median line. Posteriorly, this is anterior border of the sternocleidomastoid. This is anterior border of the sternocleidomastoid. So this is triangle. This triangle is divided into several other triangles. You can see here is position of This is hide bone. Here is fibrous pulley. Here is position of, this is anterior belly of the digastric muscle. It passes through this fibrous pulley, and here is posterior belly of the digastric muscle. This fibrous pulley holds this muscle. So this is anterior belly of the digastric. This is anterior belly of the digastric. Muscle. This is posterior belly of the digastric. This is posterior belly of digastric muscle. This is posterior belly. This is anterior belly. And here is superior belly of omohyoid, and here it turns. This is inferior belly of the omohyoid. This is superior belly of omohyoid. So you can see this is anterior triangle. It is divided into 3 triangles. This is carotid triangle. This is digastric triangle. Here is muscular triangle, and this triangle is here. This is submental triangle. So now we will discuss about the submental triangle. For seeing the submental triangle, first of all, elevate the chin upward like this and see from below, from inferior side. So like this. This chin has elevated upward, and you are seeing from here, below side. This is median plane. This is median right hand, and here is position of this is hide bone. This bone is hide bone, and here is this muscle is mylohyoid muscle. This is mylohyoid muscle. So this is mylohyoid muscle, and here is median raphe, through which both side muscle joined in median plane and attached here also. This is hyoid bone. And the muscle, this muscle, this muscle is hyoglossus muscle. This muscle is hyoglossus muscle. Here is position of, again this is fibrous pulley. This is fibrous pulley here, and this is muscle. Another muscle. This muscle is anterior belly of the digastric. This is anterior belly of the digastric muscle. Here it turns through this fibrous pulley. This is posterior belly of the digastric. So here is anterior belly of the digastric. Here is posterior belly of the digastric. In this diagram, you can see this is a triangular space. This is triangle. This is submental triangle. This triangle is submental triangle. Boundary on each side by anterior belly of the digastric muscle. This is anterior belly of the digastric muscle. And base is formed by hyoid bone, and apex is formed by chin at junction of these two lateral borders. These two joints here at the chin. So this is base, this is apex. These are two lateral boundaries. And floor of this is formed by, you can see in this diagram, this floor is formed by these muscles. This muscle, this is known as mylohyoid muscle. So mylohyoid muscle form the floor, and also median raphe. So mylohyoid muscle and median raphe, this form the floor. This is median raphe. This forms the floor of this triangle. Roof is formed by skin and superficial fascia and investing layer of cervical fascia. Content of this is lymph nodes. There are 2 to 3 submental lymph node. This submental lymph node is present here. The area drained by submental lymph node you can see here in this diagram. In this diagram, the area of the, here is position of the triangle. This is lymph node here. This lower lip, this portion of the chin and the tip of the tongue, this area drains into, and adjoining part of the gum, teeth, so this area drains into submental group of lymph node, this lymph node. So this is all about the submental triangle. Thank you. So now we'll discuss about the another triangle of the anterior group. This is anterior triangle of the neck. It is divided by anterior belly of the digastric, posterior belly of digastric and superior belly of omohyoid into carotid triangle. This is digastric triangle, muscular triangle and submental triangle. Now we'll discuss about this carotid triangle. Boundary of the carotid triangle you can see here. Carotid triangle is anteriorly bounded by, inferiorly it is bounded by, anteriorly it is bounded by this is superior belly of omohyoid, superiorly this is posterior belly of digastric, and posteriorly this is anterior border of sternocleidomastoid. Here another muscle is also present, that is stylohyoid muscle. This is stylohyoid. So this superior boundary is formed by posterior belly of the digastric and this stylohyoid muscle. Another muscle is stylohyoid. This is boundary. Roof is formed by ischial, superficial fascia, which contains platysma. Here is, we have seen in previous lecture, this is internal jugular vein, cutaneous nerve. After these structures, you will find the investing layer of deep cervical fascia. After removing these structures, you will find this triangle. Now I will discuss about the floor of this triangle. The floor of this triangle is formed by for floor, we make another diagram. This is hide bone. This is hide bone. Here is larynx. This is cricoid cartilage. This is trachea. This is oblique line. This is thyroid membrane. This cartilage is thyroid cartilage. This is hide bone. This membrane is thyroid membrane. Anteriorly become thickened, form thyroid ligament. This is thyroid ligament, and a muscle extend from here to here. This muscle is thyroid muscle. This muscle is thyroid muscle. This is thyroid muscle. Another thing, this is styloid. See, here is styloid. This style process, styloid or ligament. Here is position of inferior constrictor of the pharynx. This is inferior constrictor of the pharynx. So this is here. This is esophagus. This is pharynx. This is inferior constrictor of the pharynx. And from here, this is middle constrictor of the pharynx. This is middle. This is inferior constrictor of the pharynx. And here is position of thyroid, and another muscle which attach here, that is this is hyoglossus muscle. This is attached with the hide bone and tongue. This is hyoglossus muscle. Position of the triangle is here. This is position of the triangle. This is position of the triangle, like this. So in this diagram, you can see the floor is formed by this muscle. This muscle is thyroid muscle. This muscle is thyroid muscle. Between hide bone and thyroid cartilage. Here is inferior constrictor of the pharynx. This muscle is present, and here is middle constrictor of the pharynx. This muscle is present, and some part of this muscle. This is hyoglossus. This muscle is hyoglossus. So these structures present in the floor of this triangle. So you have seen the boundary, floor, roof. Now we will discuss about the content of this triangle. Here is external carotid artery, which divides into internal. This is external carotid artery, which divides into the external carotid artery. Sorry, this is common carotid artery. This is common carotid artery, divided into the external carotid artery. And this is internal carotid artery. This is common carotid artery. And this external carotid artery gives 5 branches here. This is ascending pharyngeal, superior thyroid, lingual, facial, and his posterior is occipital. So these are 5 branches arise in this triangle. And another thing, here is position of internal jugular vein. This is internal jugular vein. Here is jugulo-omohyoid and jugulo-digastric lymph node. Here is jugulo-omohyoid and this is jugulo-digastric lymph node. This is jugulo-digastric lymph node. This is jugulo-omohyoid lymph node. Here. And the important thing, here is vagus nerve. This is vagus nerve. It gives branch superior laryngeal, which divides into the external and internal laryngeal here. This is vagus nerve. Here is hypoglossal nerve. Hypoglossal nerve. This is hypoglossal nerve. It gives ensa cervicalis here, and the nerve, which this is spinal accessory nerve. So these are the content of this carotid triangle. Thank you. Now we'll discuss about the digastric triangle. So, digastric triangle in this diagram, this is anterior belly of the digastric, this is posterior belly of the digastric. Here is the base of the mandible. Here is a line joining the angle of the mandible to the mastoid process. This line, this triangle is digastric triangle. So anterior inferior boundary is formed by anterior belly of the digastric, posterior inferior boundary is formed by posterior belly of the digastric, superior boundary is formed by base of the mandible, and a line joining the angle of the mandible to mastoid process. And roof of this triangle is formed by, as you know, this is skin, then superficial fascia, which contains platysma muscle, cervical branch of the facial nerve, then deep fascia, that is investing layer of the deep cervical fascia. Now floor of this triangle is formed by, first seeing the floor and content, we cut a coronal section. You will find here is position of this is mandible, here section, and here is position of This is superficial part of submandibular salivary gland. This is superficial part of submandibular salivary gland. And its floor, in this diagram we make floor. Floor is formed by here this muscle. This muscle is mylohyoid muscle. This is mylohyoid muscle. If you make in this diagram, so this muscle is present here. This is mylohyoid muscle, which form the floor, and posteriorly another muscle which form the hyoglossus. So mylohyoid anterior part and posterior hyoglossus form the floor of this template. This is hyoglossus. In this diagram, here is position of hyoid bone. This muscle is hyoglossus. This is hyoglossus. So this hyoglossus also take part in formation of the floor of this triangle. And here is also middle constrictor of the pharynx. So this also included in the floor of the triangle. This is middle constrictor of pharynx. Here is position of skin, then superficial fascia, which contains platysma. This is platysma. Then there is deep fascia. Deep fascia here is split and enclose this gland. This is investing layer of cervical fascia. This enclose this superficial part of submandibular salivary gland. This is investing layer of the cervical fascia. Here lies position of mylohyoid artery, and this is mylohyoid nerve to mylohyoid. So floor is formed by this structure. This is mylohyoid muscle and hyoglossus is mylohyoid muscle, hyoglossus muscle, and some part of here, that is middle constrictor of the pharynx. These structures form the floor of this triangle, and the content of this triangle is the submandibular salivary gland, and here is position of the facial artery. This lies here like this. This is facial artery, and another thing, this is facial vein. Here lies facial vein. So these structures form the content of this digastric triangle in its anterior part up to here, and its posterior part, in this portion, the contents are different. These contents are here. The external carotid artery. This is external carotid artery. Here is internal carotid artery. This is boundary of, this is actually line of the, this muscle lies here. That is posterior belly of digastric and stylohyoid. So this is boundary. Below to this is carotid triangle. Above to this is posterior part of, this is posterior part of the digastric triangle. So these contents are present here in this posterior part of the triangle. These are glossopharyngeal nerve, pharyngeal branch of the vagus, and these artery. So these are the content of the digastric triangle. Here lymph nodes are also present. Digastric lymph nodes are present. And this digastric lymph node drains the area of the face. As you know, this this portion is drained by submental lymph node, and here is position of the submandibular lymph node. The base area of the maxillary sinus, frontal air sinus, cheek, that means this area except this part, it drains into submandibular lymph node. So this is all about the digastric triangle. Thank you. Yes. Now we will discuss about the muscular triangle. Muscular triangle, here you have seen in this diagram. This is superior belly of omohyoid. This is sternocleidomastoid, anterior border, and this is anterior median plane. So this triangle is muscular triangle. Here anterior boundary is formed by anterior medial plane. Posterior superior boundary is formed by this superior belly of omohyoid. Posterior inferior boundary is formed by this is anterior border of the sternocleidomastoid. Here you can see the after remove the skin, superficial fascia and deep fascia, and all these three structures, skin, superficial fascia, deep fascia, that is investing layer of the cervical fascia, and also here platysma is present. So it forms the roof of this triangle. Now floor of this triangle is formed by these muscles. Here this is hyoid bone, this is hyoid bone, this is thyroid cartilage, here is sternum. One muscle is thyroid muscle. From thyroid cartilage to hyoid bone, this muscle is thyroid muscle. This is thyroid muscle. Another muscle, that is this muscle is sternothyroid muscle. This muscle is sternothyroid and this muscle is thyroid muscle. These are deeper muscles, and these two muscles are covered by another two muscles which I am drawing here, and the muscles are this is sternohyoid. From posterior surface of the sternum to hyoid bone, this muscle covers these two muscles, and another muscle like lateral to this takes origin from here, superior border of the scapula. This is inferior belly. This is inferior belly, and here is superior belly. So this is superior belly. This is inferior belly of the omohyoid. Here is fibrous pulley is present, which attached with the clavicle. So this is superior belly of the omohyoid. This is inferior belly of the omohyoid. So these structures, these two muscles are present superficially, and these two muscles are deep muscle in this region. So these structures are from the floor of this triangle, and content is nothing significant. So this is all about the muscular triangle of the neck. Thank you.